Hello, everybody, and welcome back to the IBS Freedom Podcast. I am joined by the always wonderful and lovely Amy Hollenkamp, RD to the stars. I like that intro.
Hello.
Like, that's probably the one I've used the most.
Oh my
But
gosh.
we,
I don't think there's one star I've actually, well, I mean, all my clients are stars in their own way, but
so I'm not lying.
okay. Yes.
I'm just going to go with it because in my eyes, you are a star. So we could use that definition a couple of different ways. But anyhow, I am joined by my dear pod person, Amy. And today we are going to talk about something that might feel a little bit weird for us to talk about because you'll notice our accolades and neither of us are prescribers, right? Like neither of us are medical doctors, osteopath, nurse practitioner, physician assistant. However, we're going to be talking a little bit about when it would be appropriate to really strongly consider using a prescription medication or something that is not natural. Now, again, like for us, the disclaimer on this episode is that Amy, you're a dietitian, I'm a chiropractor, like this is not in our scope of practice. So this, take this with a grain of salt. But really, this is a conversation that we've had with our patients and our clients where, we try to do as much as we can from a natural, holistic perspective. But sometimes we have to have a moment where we recognize the limitation of the natural world and where a pharmaceutical compound might be really, really helpful to accelerate your healing or just make it a hell of a lot easier. So that being said, you want to kind of lead us off? Have you had some of these circumstances where you find yourself having this conversation with your clients, Amy?
I have. And I think with my clients, sometimes I'll get emails like, okay, I started taking this med and I'm having this side effect. Should I stop taking it? I'm like, well, I can't, you need to talk to the prescriber about this.
Yeah.
So I like that you made that disclaimer because I think sometimes because we work so closely with clients, they want our opinion on things. And again, there is a time and a place for us to be like, hey, you need to talk to your doctor about this medication, but it's never sort of our job to prescribe a dose or to tell you to go off of a medication. That's not really in our wheelhouse. But I feel like because prescribers are typically MDs, or again, they're MDs, and a lot of people sort of view that as the conventional route, and they've been burned by the conventional route, that they're not even considering meds. There's an aspect of this where it's like, well, I'm going to shut that off completely. And, I've definitely had conversations with certain clients where I feel like a med might be appropriate and that they might need to ask their doctor for a medication or, again, ask if it's appropriate for them. We're not prescribers. So, but, or again, if a client of mine has been told to take a medication and I'm like, oh, that makes sense, to take that, they might be a little skeptical of it. I don't know, my doctor prescribed this for me, I'm feeling a little bit apprehensive about it. I've seen that a lot too, and sometimes it makes sense. Sometimes the prescription makes sense for that person. So I think this is a really valuable discussion because it could accelerate certain healing. It could help to band-aid symptoms in certain scenarios, which are all good things. And again, I think that we're going to talk about sort of different categories of things. But, there's a time and place for medication, and not all conventional medical solutions are bad. I think you want to find a provider that you trust and that listens to you and that you can advocate to. But, I wouldn't close the door on medications just because they're a conventional option. So, yeah.
Yeah, and I think I would start us off with two kind of bits of framework to kind of set us up for this conversation, which is all of us, right? Every single one of us has probably gone to a conventional medical doctor and been recommended a prescription, and then later on we've regretted taking that prescription, or we've questioned Like, why did they give me, like my most recent one a couple years ago, I was prescribed an antibiotic for viral bronchitis.
Right.
Like, it didn't make any sense. I looked at my diagnosis from the handout they gave me. I looked at the prescription and I was like, this is dumb. So a lot of us have been burned by that world where I do think a lot of prescribers are prescribing medications in a willy-nilly fashion, and they're not giving enough airtime to the risks and the side effects. Or like there might be something that's a natural compound that's totally viable. But I would say that the two things that you want to kind of be aware of is that medications are usually going to band-aid something. They're usually not going to actually treat the thing you're trying to treat. Right? So like if you go on, as the easy example, if you go on thyroid medication, it'll normalize your TSH until the day you go off of the thyroid medication, and then your TSH is most likely just going to shoot right back up. So like it didn't really treat the root cause of what was causing the TSH to go up, right? But it was helping your body like make the appropriate amount of hormone, or like have the amount of hormone that you needed, while that kind of gives you the opportunity to work on the root causes to some degree. So no, the prescriptions, generally speaking, from what I've seen, don't treat the actual problem. They're just band-aiding something. But that doesn't mean they're bad. And the other thing is that you do want to be aware of the risk of side effects and keep your eyes peeled for any sort of side effects. So like if you're taking, again, like thyroid medication or a Prokinetic or a PPI or whatever it might be, you want to do at least a really quick Google search of what the potential side effects are and have some awareness of that. And ideally, you would discuss the risk of those side effects with the prescriber, and then they would have some sort of understanding of like, oh, that one is really, really, really rare. That side effect I see all the time, and they can kind of guide you a little bit more. But I think that's the real rub, is like there's a lot of prescriptions that have nasty side effects that are very common. So things like PPIs and cholesterol lowering medications, and we need to use them very, very infrequently in an ideal world, because the risk benefit analysis is skewed more towards risk. But there are other medications, like I mentioned, thyroid hormone medications, that are reasonably well tolerated by most everybody. You might need to play with it to find which medication is right for you, but all of the thyroid meds are reasonably well tolerated, so I don't think there's really a lot of risk, and there's a tremendous amount of benefit that could be had if you start treating your thyroid, if you are indeed hypothyroid. So I would start us off with that.
Well, and I like that you're saying that a lot of these things are Band-Aids, but that's not a bad, like I think sometimes people like Band-Aids like, oh, that's a bad thing. I feel like we've had this conversation before where people are like, well, if it's not getting to the root, I'm just going to ignore this potential path. But I almost think of it as like, let's say it as an analogy, if you get a flat tire and you can't get to where you need to go, the spare might not be an optimal tire, but it can still get you to the next destination.
I like that.
And I think that a lot of medications are kind of like that, where maybe it's the thing that can get you to the next level of your healing. Yep. And, having these things can be incredibly helpful in moving you forward. Not everyone needs medication, but when it makes sense, it can be helpful.
Yeah, and I think they're not all created equally, too. And I will say, like, you probably get this also. Like, in our field, certainly in my field in functional medicine, I would say the vast majority of people who come to work with me very much want to treat things naturally.
Right.
And, and some people will tell me that right to my face. Some people that comes out like in their intake paperwork, but I see that as a very common theme. And that's one of the reasons why people seek out somebody like you or I, is because they've been burned, they've been abused by the conventional medical world before. And now they're kind of like the pendulum has swung now. And now they're like, no surgeries, no medication, never, ever, ever.
It's like they're jaded by the whole system on this side.
A little bit of PTSD maybe from the whole experience, which is understandable for sure. But it's like, you don't want to cut your nose off to spite your face and deny something that would be helpful and does have a low risk of side effect. And to your point, could be the spare tire that helps you get to your next destination where it's more plausible for you to use the natural stuff only. I like that analogy. I'm going to use that from now on. I like the spare tire.
Yeah. Yeah, because again, like, the spare tire isn't optimal. It's not necessarily, like, it'd be optimal for your thyroid to function without medication.
Yeah.
But, like, again, the thyroid meds can serve as, like, some extra support so that you can get the job done.
Yeah.
And get you to where you need to be. So
I will say something too. Band-Aids also can make life a heck of a lot more livable.
Right.
Like, if you're, could you theoretically heal your body despite hypothyroidism that's untreated? Maybe. I think it's debatable, but I'm going to give it a loose maybe for the sake of the conversation. But will you be quite miserable and fatigued and brain fogged and feeling wretched for a lot of that healing journey? Probably. Versus if you get on some thyroid hormone replacement and you can kind of boost up your levels of thyroid hormone and get all the cells of your body to work a bit better, you're going to be a lot less miserable in the process. So it can help facilitate the actual healing, but also it'll just make you feel less miserable in the process of the healing journey. And that has value too. Like, you're still a living human being who has, like, a life and a family and probably a job, and you need to be able to function and, like, cook for yourself and take care of yourself. And it's okay to get some help to get you through the day if the risk-benefit ratio makes sense and if it's something that is going to help with, like, something relevant for your case.
Right. I wholeheartedly agree. So, in terms of meds, I know we've been throwing around different ones. Do we just want to start with, like, do you have any ones you want to start out with?
I'll start with one that I usually use when I talk about this with patients because I think it paints the picture even more so than the others. And I'm going to be cautious to not, like, manifest this shit in my life, but if tomorrow I was diagnosed with type 1 diabetes and my pancreas just completely was like, nope, no more insulin for you, would it be smart or would it be efficient for me to go to the doctor, get this diagnosis, and say, no, thank you, I don't want insulin because insulin is a prescription? Like, no. I feel like this is one area where, like, most people kind of will get it. Like, anybody in their right mind, in my opinion, who gets diagnosed with type 1 diabetes and, like, no longer can produce insulin is going to be really, really happy that prescription insulin exists. Now, it costs way too much, and, like, the whole pharmaceutical industry here in the United States is insane, but you're just glad that it exists, right? Like, you're not gonna be like, oh, it's a prescription. But I don't want to enrage the type 1s listening to our podcast right now. Then maybe after the fact, after you get the initial help from the insulin, then you can start exploring ways to manage the autoimmunity and decrease the inflammation and maybe spare the remaining beta cells that you have left. And you can start tinkering with, like, eating lower carbohydrate diets so that you don't have as much need for insulin. I've seen that happen a lot where, like, person gets diagnosed with type 1 and they're still eating, whatever diet they were on, and they need X amount of insulin. And then as they learn more about their body and they learn more about, like, you need insulin when you eat carbs and sugar, therefore if you eat less carbs and sugar, you probably would need less insulin. And they start embarking on, like, a lower sugar or a lower carbohydrate diet. And between that and all the other stuff they're doing, then they can naturally decrease the amount of insulin that they need. Like, that is perfectly reasonable. But the point is, in the beginning, when things are really acute, you're not going to deny the insulin. You're just going to take it and be glad that it exists. So I like to think of it from the perspective of the type 1 diabetic, where, like, it could be life and death, the difference between taking that prescription or denying that prescription. Right. So let's go back and forth. So I start us off with insulin as the starting point, not related to the gut necessarily, but
well, one that you didn't mention yet in some of the examples, but I know we've talked about before, is like some of the stuff for like mast cell or histamine issues, like sodium cromolyn or, you know, some antihistamines that can be really beneficial for a period of time to manage some of the histamine reactions. I think those can be really beneficial. I've had a number of clients do really well on some of those medications. So again, I know when you were like listing some, I didn't hear that, but I know we've talked about it before as being helpful. So just wanted to throw that one into the ring.
Yeah, that's a really good one. And I think another way that you can kind of frame prescriptions oftentimes is that where an herb or a supplement is generally going to be a bit more gentle and subtle. And it's kind of the equivalent of like tapping something.
Right.
A prescription medication is going to be a sledgehammer that goes whammo. And like, you know, it's whatever the effect is, it's usually going to be that much more overt in your face when it's a prescription because they're stronger. A lot of the time, at least. So, you know, with something like this, like if you have full-blown mastocytosis or mast cell activation and, you know, the histamine is driving you crazy and you're miserable with symptoms, you've got like POTS or whatever it might be, yes, you can get a certain like level of antihistamine support from things like nettles and quercetin and vitamin C, but you could find that you function a heck of a lot better if you take the cromulin and you can stabilize your mast cells with a nice, strong prescription medication. And again, it's very well tolerated. I have yet to hear of anybody who had negative side effects from taking cromulin. So I think that that's a really good one. And also I would say the H2 blockers and the antihistamines like Zantac and Zyrtec can even be useful for just blocking the histamine receptors as much as humanly possible for the short term until you kind of figure out the root causes of like why you have the histamine stuff going on. But I've had patients who have done that too.
Yeah, I think especially if there's like, you know, a GERD or almost like a histamine-related increase in stomach acidity.
Yep.
I know we've talked about that before, that, you know, some of the Zantac, those can be really helpful and probably better, like, treating more of the main issue than just the PPI.
Yeah.
So
they're also a lot easier to wean off of.
Right. So I think that's a good one. So yeah, I think again, I have a client right now who was asking me, who was on sodium cromolyn and then was like, went off of it because she was a little bit concerned about it.
Mm-hmm.
And she had emailed me and was like, my doc wants me to go on sodium cromolyn, but I'm like worried it might do this. And I'm like, I've never heard it doing that. And she ended up going back on it and feeling a lot better.
Yeah. Like I said, it seems well tolerated from what I can gather. Again, disclaimer, I'm not a prescriber, but from what I've observed.
Right.
Yeah, and to kind of piggyback off of that conversation, the next one, believe it or not, I would say is PPIs.
Yeah.
They do have a time and a place. Again, I think that the risk-benefit analysis is quite different for a PPI because there is going to be the risk of it messing with your microbiome, messing with your motility, causing deficiencies in nutrients like, you know, the B vitamins, calcium, magnesium, iron. A lot of minerals can get depleted because of the lack of stomach acidity. But I will just throw out there to put a bug in everybody's ear that there is a time and a place for PPIs. So I think I've shared this before on one of the episodes at some point. My mom had what they called a geyser of a bleeding ulcer.
Right.
It was such that she started out the day just tired for some reason, like more tired than she normally is. Like she showered and then she had to lay down in her bed for like 10 minutes to recover from showering.
Yeah. Oh my God.
And, you know, she didn't think much of it. She went to work. She was in a meeting. And I think it was shortly before lunch or maybe around lunchtime that she passed out and they rushed her to the ER. And then she started having like the coffee ground stools. And by the time they got in there and they figured out what was going on, they saw that she had an ulcer that was located right over a major artery. And that's why they called it a geyser, because it was literally just spurting blood. And she lost half of her blood in one day. Like her
Oh
hemoglobin
my
dropped down to
God.
like 6. Yeah,
Oh
it was really
God.
scary. And, she had to get 2 blood transfusions because she had lost 50% of her blood. And that was an instance where, of course, they put her on a very high dose of a PPI.
Right.
And I think, what's the other one? Sulcrafate, and I forget what else. But she was in the hospital for a couple of days. And this is another area where it's like, I know it's really extreme, but you wouldn't tell a person in that situation,
Right.
Mom, don't take the PPI. Those are dangerous. Like at that point, we were just happy that she was alive. We were just happy
Right.
that they were band-aiding it. And to be honest, I did have her continue the PPI for a couple of months. But here's the key again, knowing the risk-benefit ratio and knowing that it's not really causing the actual problem, or I'm sorry, it's not treating the actual problem, and knowing that I didn't want to set her up for more dysfunction down the road, after a period of a couple of months, we did start weaning her down off of the PPI, although the initial recommendation from the doctors was, yeah, stay on the PPI forever.
Right.
And she did very well coming off of it. We used a lot of herbs and really soothed and coated her stomach. But the point is, we did have her on that PPI for a couple of months, well aware of all the risk of being on a PPI, but at the time it made sense. So if you've had an ulcer or if you have like Barrett's esophagus or anything like precancerous, there might be occasions where it makes a lot of sense for you to be on a PPI. But I do think that probably 98% of the time when PPIs are prescribed, they are done so in a willy-nilly fashion. And I think that it's an inappropriate prescription for most people. But there is that like couple percent of people who really, really need the PPI, to be honest.
Right. Yeah, I wholeheartedly agree. I think there should, like what you're saying, be an off ramp, which is usually the problem.
Yeah.
There's no
Yeah.
off ramp. And that's something, if you are going to go on a PPI, to really have a game plan laid out with your doctor to like really kind of hone in on that. Like, okay, I'm going to go on the PPI. What's the game plan to go off the PPI? Right out the gate. And I think if you have that in place, you're going to be in good shape. So yeah, PPIs, they're a tricky one, but I think again, that definitely a time and place, like what you're saying. I like, the ulcers, Barrett's, anything precancerous, I think is all makes total sense to be on a PPI.
Yeah. And can I interrupt you for a second too?
Yeah.
And I'll just throw out there, in my every episode ritual of throwing my profession under the bus in some way, I will confess that this is one thing that I've never really seen eye to eye with the chiropractic profession on. I joke, when I went to chiropractic school, I was normal. Like I had all the drugs, all the vaccines, all the junky food. Like I was not holistic minded at all. And chiropractic really opened my eyes to that, of like how the body can really heal itself and what's possible from a natural perspective. And even so, I was really surprised that in my experience, the vast majority of the chiropractors I met and an awful lot of the students that I went to school with were in this really hardcore mentality of drugs and surgery are always bad. They are all bad. They're all evil. No drugs, no surgery, never, ever, ever. And almost to the point where, like, if you did take a drug or get a surgery, like, it was almost kind of framed as, like, a failure. Like, you didn't try hard enough to treat it naturally. You should have gotten adjusted more. And I'm not saying that that's all chiropractors, but there's definitely a pocket within chiropractic that is not small. And they're very vocal about this. And I think that it's detrimental because, again, like, and actually, if I could steal your turn really quickly, I would even say antibiotics. Are antibiotics always appropriate when they're prescribed? No, I just shared a couple years ago, I got prescribed antibiotics for what was diagnosed as viral bronchitis. And that was stupid. That was dumb. And I could just go on forever about that. But if I get Lyme disease again, you can bet your bottom dollar I'm going to be taking doxycycline. You sign me up for the drugs, man. I am not going to try to tackle Lyme disease with like oregano oil or something. And it's not that oregano is not powerful, but I'm not going to risk it because Lyme disease can F you up. There are certain things where like, I don't want to do with the wrong stuff. Like when I have surgery in April, if they recommend antibiotics as part of the pre-surgical kind of prep, I'm going to take it. I'm not going to worry about it. I would rather take the antibiotics and work on my microbiome later than deal with an infection deep in the ear infecting the new eardrum. Right? Like there's just, you've got to weigh the pros and cons. And another one too, I'll say, is that with dental work, if they, nick your gums and you're bleeding a bit, you could introduce mouth bacteria into the bloodstream. And then there's this weird kind of phenomenon where oral bacteria that get into the bloodstream tend to hunker down in the heart and on the heart valves. So when a dentist tells you to take an antibiotic, I would just take it. I've had many patients ask me that over the years, and every single time I'm like, take it. Just do it.
Yeah.
We'll worry about your microbiome later. This is one area where like, I don't know how commonly that happens, but you don't want to be the person who refuses the antibiotic, gets dental work done, and then has like, myocarditis or some wacky thing that then is going to affect your heart in a really nasty way. So I'll start us off, but let me ask you this to follow up on this one. What about, have you had patients where maybe you've tried to treat the SIBO for a while and you get to the point where you're like, maybe we need to consider like Xifaxan or some sort of prescription for the gut microbiome itself? Have you had some of those circumstances pop up?
Yeah, I mean, again, I think that like typically with SIBO, I will tell my clients it's a continuum. So like there's really gentle things, almost like the probiotic, prebiotic type approaches.
Mm-hmm.
And again, maybe an herb or two where it's like, oh, it's pretty, like there's going to be very little collateral damage here.
Yeah.
And then again, like you can move into like, okay, maybe we play around with a little bit of a stronger combination of herbs to try to clear this thing out. And then it's like, okay, well, if that didn't really budge it, then it's like, well, what else is there? Mm-hmm. And then it's more the antibiotic route. I found it like, it's not overly common where we need to go the antibiotic route, or at least I haven't found it to be super common that we need to go the antibiotic route. I think there's certain scenarios where people are really sensitive to herbs. It's like, okay, they're sensitive to herbs, they're sensitive to like there's really no other avenue. Yeah. And it's like, okay, I guess we can give rifaximin a try. So again, I think there are situations where I've definitely suggested, or again, like it was prescribed, and I'm like, well, you've tried other things. We could try the rifaximin and see sort of how it goes. I think that there is this mindset within the doctor world, or like the MD conventional space, that like, oh, rifaximin, it just stays in the small intestine, so it's totally benign. And like, it's totally, it's so gentle or whatever because it doesn't affect the colonic bacteria, which it's still affecting the small intestinal bacteria. Like, you don't want to be taking it all the time, like cyclically. Like, I think a lot of doctors use that mentality of, oh, it's just staying locally in the small intestines. We'll just take it cyclically. I find that it tends to lose efficacy over time. So the first, if it's going to be effective, it's going to be effective the first couple times. Yeah. First 1 to 2 rounds. And then it's like really loses its efficacy over time, or at least that's generally the trend I see. But again, I think there are situations where it makes sense as an option. I always say, like, you don't want to eliminate tools in the toolbox. Like, that's a tool, but you might want to try some other things first that have less collateral, like risk-benefit analysis. Like, there's less risky things that can often be really effective. But again, there's a subset that might need to try antibiotics.
Yeah, and I think, to go back to one of my earlier points, rifaximin feels like it treats the root cause because for most practitioners, conventional or otherwise, for most practitioners, they will say, SIBO was the root cause of your IBS, and then the buck stops there. And they're like, okay, SIBO is the root cause. Therefore, if we treat the SIBO, we treated the root cause. Hooray, you're off frolicking into the rainbows. The key is that the rifaximin might treat the overgrowth in the moment, but you still want to dig deeper and ask, why did I develop SIBO in the first place? And see if you can rule in or rule out likely scenarios and understand. And then that's where the real healing is going to occur, right? Like, if you have low stomach acid and that was the cause, then you really need to address low stomach acid. But band-aiding the overgrowth can make a really big difference. So it's like that understanding that medications most frequently are not treating the root cause. They're just band-aiding something. And it's not to say that's a bad thing, but it's like if you take a prescription under the assumption that it's magically going to cure you or it's magically going to treat the root causes, then that's where you're going to be really disappointed. But if you take a medication knowing that it's just going to help you get to point B, or it's going to help you, make your quality of life better, or it's going to help with one of the downstream consequences while you work on the root causes, then I think that these can be used reasonably successfully. I'll share 2 examples too, though. I remember it was years ago now, but I worked with a young patient. I forget how old he was. I think he was like 7. And we thought that his SIBO, he was diagnosed with SIBO, and we think that his root cause was that he had really bad reflux as a baby. So he was on like reflux medication from a very early age. And when he got to me, we diagnosed him with SIBO, and we tried to do the herbs. But because he was young, he was only like 7 years old, he was not good at swallowing pills yet. Yeah. And I remember I had the mom break open capsules of FC-cidal and dysbiocide and like mix it with applesauce. They taste really bad, just for future reference. Like, I didn't know that at the time, but she did that, and she only got like 1 dose in him, and he would not take the rest. Yeah. And then I think we might have tried that liquid biocidin stuff, and like that didn't really do anything. And I forget what else. We might have tried another thing, but we got to the point where it was like, your ability to swallow pills, or your inability to swallow big pills, is hindering the ability to use natural stuff. And also because he's a kid, we can't really get him to take something that's truly, truly nasty. So, like black seed oil or something like that. Like, we couldn't really get him to take anything that was super gross. So I remember I Googled it and I was like, you know what? The size of the pill for rifaximin or Xifaxan was smaller than FC-cidal and dysbiocide, if I remember correctly. Or maybe it was like a tablet, and I said maybe you could like break the tablet into little fragments and get it in him that way. But anyway, that was an example where we tried the natural stuff and we were like, you know what? This is a case where the prescription makes a heck of a lot of sense, because it might be the only route that we can get this stuff into his body to actually treat the SIBO. And if I remember correctly, I do think it helped him. It was years ago now, so I don't remember off the top of my head. And I have a patient I'm working with right now where we are considering doing rifaximin. I think she already had it prescribed to her. She just needs to fill the prescription, if I remember correctly. But she has SIBO and gets a lot of bloating with the SIBO. And the bloating causes really bad reflux. And, looking back through her root causes and doing the testing, we're pretty sure that the root cause of her SIBO is low stomach acid. But when you have acid reflux, the thought of taking betaine HCl probably makes you want to cry, right? Like, it's not really appropriate to give her betaine HCl right now because she's experiencing reflux. But so it's like we're in this catch-22 of like the SIBO and the bloating from the SIBO is putting so much upward pressure on the stomach that it's making the reflux a lot worse. But the thing that we need to do to treat the SIBO ultimately is going to probably piss off your reflux if we don't get it more under control. And we've done some antimicrobials and prokinetics, and she hasn't made a tremendous amount of progress on them. And we're finally at the point now where we're like, you know what? Maybe it makes sense to do the rifaximin for a short period of time, the 7 or 10 days, whatever it is that it's prescribed for. And if that can cut down on the bloating enough, then that might allow you to start treating the low stomach acid and make some headway on the root cause, and then the SIBO should be better. And it's like, we're going to try to use this as a way to, get us to the next phase of healing, like the spare tire analogy. And it's like, when you're stuck in this catch-22 and you don't know how to break that cycle, sometimes the best option is to do something like a prescription where it's reasonably well tolerated and it has the ability to knock down the SIBO a couple of pegs very, very quickly. And, I think that might be a really big thing for her. So,
yeah. Well, I think that makes total sense. And just a couple other things. One thing I'll mention about rifaximin too is I think if there's bile flow issues, it's going to be less effective, because with rifaximin, it's bile activated. That's why it stays in the small intestine. So like if you're someone that has some bile flow issues, it might be less effective for you compared to someone that doesn't have bile flow issues. Again, go ahead.
Sorry, that also makes me wonder about the people with bile acid malabsorption.
Right.
Who have bile getting into the colon. So if you have bile acid malabsorption, there might be more detrimental effect to the colon microbiome in cases where you take rifaximin. So that's very interesting.
Yeah, I think you could be right. And again, I haven't necessarily looked really closely into my particular clients that might have like their gallbladder removed and taken rifaximin and how that affects its efficacy. Or again, if we just think there's some liver gallbladder stuff going on, that might be hindering bile flow. But I do think it's something to keep in mind or consider, which is probably something to talk to a provider about, if it makes sense. But again, something just interesting about rifaximin. The other thing I will say, so when I got diagnosed with SIBO, I'm trying to remember what year it was. I feel like it was like 2015 or 2014 that I was diagnosed with SIBO. Rifaximin was even harder to get back then. Like, it wasn't approved really at all yet for even IBSD. So my provider couldn't get it for some reason. Maybe it was going to be like $2,000. I don't remember all the ins and outs, but I know that my provider suggested SIBO instead, which again is a very, very strong antibiotic that, again, the risk of that compared to rifaximin is way different. Yeah. So, I'd be a little bit careful about what antibiotics you're using, especially with SIBO. Again, I would probably avoid SIBO. I've seen it with a couple of clients.
Did I ever tell you?
Go ahead.
I have a friend from undergrad who had a ruptured Achilles tendon because she was taking SIBO.
Oh my gosh.
That stuff does happen. It is out there.
Well, it's black labeled. It's a pretty intense antibiotic. And honestly, I feel like it probably set me back like a year because it just destroyed the large intestine too. And it's not to say you can't use other antibiotics outside of rifaximin, but I would try to avoid SIBO. If that's on the table. I don't see it super often, but I have seen it before.
I think the pretty classic combo seems to be rifaximin and maybe metronidazole, or Flagyl. So anything outside of those medications, I'd probably be pretty hesitant. SIBO, that's in the category where I would take almost any other antibiotic before I took SIBO. Just again, knowing one of my best friends freshman year of college, I forget why. It might have been after she had appendicitis. She was taking Cipro, and
Yeah.
then she bust open her Achilles tendon. So I think that's one where the risk benefit analysis makes me cringe quite a lot.
Right.
Versus, like doxycycline or a Z-Pak or, something else. I know I had another patient who was prescribed Augmentin and did very poorly on Augmentin. Had a lot of negative repercussions from that prescription. So I'd probably be very cautious with something like Augmentin as well. But there's a lot to unpack with antibiotics. But I do think, they could be helpful in certain circumstances. Like I said, if it's like surgery or dental work or, tick-borne illness or something like that, I've taken the antibiotic all day, every day. And I'll try to support my body in other ways around that. With the SIBo conversation, I do think that probably a lot of people take rifaximin and they don't really need to. I think the herbals would work just as well for a lot of people, but sometimes there is a time and a place where taking the prescription antibiotic makes a lot of sense.
Yeah.
I've completely lost track of whose turn it is, by the way. I think I started out with the antibiotic question, so I think we're kicking it over to you.
So I think that we can talk a little bit about Prokinetics that are pharmaceutical.
Yeah.
I think that the Prokinetic pharmaceutical stuff is really interesting. I've had people do really well with prucalopride, especially at low doses. Again, it's not necessarily something that you need to take like the full 2 milligrams of, which is like a typical dosage. Or again, like even 1 milligram. Some people cut the I'm not sure if it's a tablet or a capsule, but they'll cut it in half.
Yeah.
To do a smaller dose, but that's one I think that can be helpful. Again, LDN's sort of it has prokinetic properties and other properties too. And for some people that have immune system stuff going on or inflammation at play, that one could be helpful. So, again, I think that, I think they're not always needed. Like, again, not everyone with SIBO needs prucalopride, not everyone with SIBO needs LDN. It's probably a smaller group. But again, I think that there is a time and a place in a case, like a person's case that could benefit from pharmaceutical prokinetics.
Yeah. Yeah, and I think, you could always start by trying out the natural prokinetics. And if you guys don't know a lot about prokinetics, we actually have a whole episode on that topic. But I have found that prokinetics are very helpful for run-of-the-mill IBS as well as SIBO, to a point where I do this experiment with people and I have them try a bunch of different ones for like a week at a time. I call it speed dating. And I have them kind of take them all for a test spin and give me feedback on which one they like. Yeah. And I've been doing that for probably 2 or maybe 3 years now. So I have data points on probably 200 people by now. And out of that, there's only been like 2 or 3 people who didn't see a difference with any of the prokinetics.
Right.
So that's pretty good odds. What is that, like 1 or 2% failure rate for the natural prokinetics?
Right.
So, try that out. I have a YouTube video about that. I think it's literally titled like Best Prokinetics for IBS and SIBO 2020, I think is what it's titled. But if you search for that on YouTube, you'll see kind of the breakdown of that data collection I've been doing. But, it's like start with the natural ones. And then if somebody has limited benefit or no benefit from the natural prokinetics, then that's the point where I would open up the conversation of, hey, maybe we should, pursue a prescription for something like Motegrity or LDN. I think that, and I do have some patients too who get like some part of the way with the natural prokinetics, and then they get like another part of the way with the prescription prokinetics. So you can layer them together and you can take them together typically. So I think that prokinetics can be really helpful. I would always start with the natural ones because they're cheaper and easier to come by and probably safer, I would just guess. But those 2 that you mentioned are reasonably well tolerated. as well. I'm less versed in like what is it, like low dose erythromycin and like some of the other prokinetic medications I'm not very versed in, but I've had quite a few people do well on Motegrity, and I could think of a couple people who have done well in Aldion as well.
Mm-hmm. Yeah.
Yeah, that's a good
one.
one.
I think the Prokinetics, and I think you're up now with the next.
Yeah, and we might be winding down a bit, so we've hit some of the big ones as far as like the IBS and SIBO space, but this will dovetail from our previous conversation about diarrhea. Cholestyramine can sometimes be helpful, particularly in cases where we suspect bile acid malabsorption issues. Just kind of binding up and soaking up some of that excess bile can be really helpful symptomatically. I remember I had a patient, his IBS started before getting his gallbladder out, but then he had his gallbladder taken out and it got way worse.
Right.
And then he had like chronic diarrhea from that. And it was one of those conversations, like we said earlier, where his prescriber had prescribed cholestyramine and he didn't want to take it. He was like, no, it's a drug. Drugs are bad. No way. I mean, I'm way oversimplifying the conversation, but basically he was apprehensive because it was a drug. And when we talked about his symptoms and what I thought was actually going on, because as a side note, nobody told him that he had bile acid malabsorption. And that it was probably because of the gallbladder removal. Like, nobody had that conversation with him. But once he understood, like, the mechanism of what was happening and why that was likely to be helpful for him, he did start taking it, and he did find that it was helpful. So I think, in situations where there's excess bile, the other area that I'm less versed in, but I'll share anyway, where cholestyramine might be worth looking into is for mold recovery purposes. I know a couple years ago I heard this guy, Andrew Heyman, who does research with Dr. Shoemaker. I heard him lecture at a conference, and he was phenomenal. He was amazing. But one of the things he mentioned was that he said a lot of natural binders don't actually bind mold mycotoxins. Like if you take charcoal or clay or something like that, or pectin, it doesn't really bind mycotoxins, but cholestyramine does. And that can help you bind it and excrete it out of your body more efficiently. Or he also shared that the fiber in okra and beets seems to bind mold mycotoxins to some degree as well. So he was like, and he started out as an acupuncturist, and then he went on to get his medical degree and is a licensed MD. But he shared, for people who want to do it the natural way, the okra and the beet can be helpful. But if you have the ability to prescribe, you might really want to look into cholestyramine because that just binds up the mycotoxins so much more efficiently. So not a mold expert, but for what it's worth, it might be helpful for cases of really bad molding as well.
Right. Oh, and I've heard that too. That's a good one. I think the only ones or the couple things that are coming to mind too is you were bringing up diarrhea. I think in situations where the diarrhea is very acute, so like in food poisoning situations, or even if you just have like, typically, again, I sort of more reserve this for food poisoning or like very acute issues, but like even things like Imodium or kaopectate, like in situations like that could be helpful. I've had some clients tell me too, where like they always have flare-ups when they travel, and they're like so nervous about having diarrhea, like on the plane and things like that. And I'm like, why don't you just like, Imodium helps. Like, why don't you take Imodium like the day that you're flying, just to kind of help you mentally not be nervous and stressed about it. And then again, like on the way home, you do the same thing. I've talked to a client about that too. So I think that there's sometimes doing some interventions with like over-the-counter stuff can be helpful too for things like diarrhea if you have a food poisoning, or again, just like an acute issue that you want to handle a little bit.
And you just touched on something, maybe unintentionally, but I'm really glad that you did.
Oh.
Some of this conversation kind of boils down to being kind to yourself. and cutting yourself some freaking slack. And this is unrelated to IBS, but I think it's worth having this conversation anyway. My best example from my life was when I gave birth to my daughter. I do this stuff for a living. I'm in this hippy dippy profession, and, naturopaths and chiropractors, they're all like, no drugs, no surgery, natural childbirth only.
Right.
And again, there is a definite tone amongst our profession as well as just the internet. There's this distinct tone of women who are able to have natural childbirth with no drugs, no intervention are held up on this pedestal. And if you needed a C-section or an epidural or a drug, then there's kind of this distinct tone of you should have tried harder, or oh, that's not good. And you're going to screw up your kid for the rest of their lives. And mom guilt is real, let me tell you. So anyway, the normal mom guilt plus the wanting to be the crunchy hippy dippy person because of what I do for a living, I went into childbirth fully I'm having a natural childbirth, come hell or high water, I could do this, hell yeah. And I will tell you, one of the most significant regrets I have from giving birth to my daughter was that I did not allow myself to get the epidural sooner. I let myself suffer. No joke. This is I still have PTSD from this, I swear to God. I let myself suffer so much longer than I needed to, unnecessarily, and I forced myself to deal with that intense pain for so much longer than I should have, to a point where I was in really, really bad headspace, my mental health. I was terrified of the next contraction, and I was I couldn't focus, I couldn't breathe, I couldn't do anything because I was so terrified of the next contraction. And by the time I finally conceded to getting the epidural, it's my brain was toast. I joke, but seriously, I lost neurons that day, and they will never come back. They're gone. And I look back now, and that epidural was the best thing I've ever gotten in my entire life. I would get one again and again if I could. Just knowing that that was how that birth was for me. Right. And, I look back and I'm I should have gotten that epidural probably 12 hours sooner than I actually did.
Oh my gosh.
And it was my priority was to do the natural thing. Right. My priority was to be tough enough or a good enough mom to get this imaginary accolade that realistically very few people care about in the grand scheme of things. It was absurd that I put that on such a pedestal, and I was striving toward that to the point where I let myself suffer so much that it was awful. So similarly, you can be kind to yourself, and you can be empathetic and understanding of yourself, and you can cut yourself some freaking slack and suck it up and take the medication if it is appropriate and safe, and if you think it's going to help you. Nobody's going to give a shit if you do things 100% naturally, or if you get a little bit of help from a medication. It might feel like people care, with social media and Facebook groups and the SIBo forums, and your hippy dippy naturopath might care a little bit. But in the grand scheme of your entire life, when you're 80 years old, are you going to look back and think, God, I wish I had treated my SIBO totally naturally when I was in my 20s?
Right.
No. No, it's not going to matter.
Well, let's hope not. Let's hope.
Well, yeah. Yeah.
Yeah. I think that's such a great example, because there is some benefit from a mental health standpoint to try to eliminate symptoms and eliminate pain. And there's a lot of these medications that could make things more bearable. Yeah. I know you're mentioning, again, the thyroid med's a great example. Even again, the Imodium situation, that particular client was going on a trip with her husband and just wanted to have a good time and didn't want to worry about the situation with her gut. And again, she only had to take the Imodium on the flight there, and the flight home. And it's like that seemed to help her mentally and not stress about, you know, having to go diarrhea on the plane or whatever it was. And again, I think you're right. There is a level of like, and I think probably in the SIBO and IBS space, unfortunately, a lot of providers guilt and shame too.
Yeah.
And so it's a bummer. I think it's really unfortunate. And I would say most, like, depending on what sort of medication you're taking, there's other areas within the IBS and SIBO space that people definitely, I'm talking about the diet in particular, where providers will shame people for not being the best version of yourself or whatever, you know, kind of BS thing they'll feed to you. If you're not eating a particular way that they think's optimal. But yeah, I think these solutions can be important just to help you live your life, which is really a key aspect of recovering from IBS and SIBO.
Yeah. Well, and we've talked about that too, and I know we've talked about that on Instagram as well, that just living your life and letting the healing, letting your gut health take a little bit of a back seat so that you can go hang out with friends or family or play basketball or go on a trip with your husband or whatever it might be. Like, doing those things are going to be good for your vagus nerve, and they're ultimately going to be some of the most profound healing you can do. So if a medication helps you get to the point where you can live your life to the fullest and enjoy your ride on planet Earth, because let's face it, like, we only know for sure that we have one life to live on planet Earth, and we're on this rock hurling through space. We don't know if we're going to get another go at this, and we've got to make the most out of this experience, this lifetime right now. So, yeah, and I think, to sound a little bit corny, but I think it's the God's honest truth, sometimes taking a medication can be like a really good practice in self-love.
Yeah.
You know?
Well,
like,
and I think you're dead on with like the living your life scenario, and I feel as though, looking at the clients I've worked with, I feel honestly like the clients that do really well working with me have not totally abandoned their life. Like, they're doing things. Like, when we catch up each time, it's like, oh, I was out with my boyfriend, or I did that. Like, you know, we catch up before each call. Like, what have you been up to? Anything new? I think the people that aren't unilaterally focused on their SIBO journey, but have a life outside of the SIBO space, tend to do so much better, and it makes so much sense.
Yeah.
But I think there's this idea, and I've been caught in this scenario of like, oh, I just have to be unilaterally focused in order to get better. But it's just not typically what I see working. Like, you can't abandon all these things that are really key to health, and the things that, you know, make life worth living, you know, that provide joy and things like that. It's like so imperative to moving forward and healing that lose the priority that they need to be.
Well, if you think about it, there's a lot of layers in the SIBO space and the IBS space that gradually lead people down the path of being unilaterally focused on the healing, right? Like, we have practitioners, both conventional and holistic. I've seen it both, but we have practitioners who, you know, like, test you for SIBO, treat you for SIBO, retest, and then the test is still positive, or maybe it's worse. And there's a lot of practitioners who would see that pattern and go, you didn't try hard enough. You must not have been strict with your diet, or you didn't take every dose of the whatever, or we didn't try hard enough, so we need to do better. We need to do more. And that's like one drop in the shame, I need to try harder, I'm not trying hard enough bucket. And then you log on to the Facebook forums and you see people, somebody might post with a simple enough question of like, does this food feed candida? And you're going to get people in those Facebook groups.
Dangerous question.
Or like, is this supplement good for SIBO or whatever? And like, or, hey guys, here's the protocol that my doctor recommended, or here's the protocol I've developed for myself. What do you guys think of it? You see these questions all the time in these groups, and inevitably you're going to get a handful of people who are like, I can't believe you would even consider eating a carrot. Oh my God, that is just the worst. I can't even believe you. And it's like, whoa, Brenda, chill out. But or like, here's my supplement protocol. What do you think? Oh my God, well, I cannot believe that you would even consider taking a probiotic, or I can't believe you wouldn't even add berberine. How dare you? Oh my God. And it makes you feel like a piece of human garbage to get those comments. And then, then you have your own kind of internal dialogue of like, why am I not getting better? It must be my fault. I didn't try hard enough. And like, we all have that internal critic that drives us crazy. And it's like, there are so many things that lead people down the path of thinking, I need to try harder. I'm not trying hard enough. I'm not doing enough of the things. I just need to layer in more supplements or more dietary restriction. And like, it's a slippery slope for sure.
Yeah. It really is. It's kind of it bums me out a lot.
Or I'll throw one out there too, to totally interrupt you for like the 5th time this episode. Sorry.
No, you're fine.
There's so much information, right? Like people feel like they have to learn everything on their own, and they have to figure out how to heal their body on their own, like they're alone in this journey. So what happens? You go into a Facebook group with literally 8 gajillion posts. So no matter how much you scroll, there's always more that you could be reading in those Facebook groups. You attend one of those virtual summits, and, there's like 30 different lectures, and you can't listen to all of them during the free time that they give you, the 5 days or whatever it is for those summits. So then you feel compelled to purchase the summit and then listen to all 32 of the lectures every time there's a new summit, and there's one every other week coming out. Then, then you might be like, oh, maybe I need to be even more like current on the research. Maybe I need to read on PubMed. And guess what? That's a whole nother vortex that you're going to fall into. You type in SIBO on PubMed and you get like 8,000,002 articles. So then it's like people have this impression of like, I need to try harder. I need to read more. I don't understand it enough. There's so much information that I'm not even getting. And like the answers lie on the 502nd page of the Google search. Or the 301st page of the PubMed search. And I just need to work harder and dig harder and read more and do more and listen. And I just need to learn more. And it's like, whoa. That's a lot to unpack. But, and it's, then you get somebody who's staying up until 2 a.m. reading on PubMed, and they're not living their life.
Well, and I feel that it's really important to have a provider that you trust, because to me that sort of comes from this mentality of, I need to solve this myself.
I'm alone.
And that's a really tricky place to be in. And again, I've been there myself, and inevitably it's really, really, really difficult to figure out SIBO on your own with little experience working. Again, like, we've worked with a lot of people that have had SIBO and have learned, what typically works, what doesn't. We've learned, I think, to trust our guts about certain things. We've learned to we've just continuously learned over time working with a lot of different cases, what makes the most sense in different situations. And I think that there's an aspect of what you're saying where it's like, if you have a provider that you trust and you can let go of the responsibility of solving this on your own, that doesn't mean you never research again or aren't interested in the topic at all, but it's more just like, the more you can let go and let someone else sort of guide you or work closely with the provider instead of Google searching every 2 seconds, it can help relieve some of the stress and pressure and time that you're spending in the SIBO realm to focus on living if you have that trust in the provider and you're working closely with a provider that you really trust and you're buying into the plan that's being laid out.
Yeah. Well, and sometimes, like, I think it's a good kind of exercise too. Like, a lot of times when I start working with a new patient, I actually tell them, give that burden to me.
Right.
Like, hand it over.
Right.
Like, this feeling that you have to know it all, you have to learn it all, you have this burden on your shoulders that you have to solve it, you have to figure it out.
Right.
Like, just give that to me. Like, I can hold on to that for you, and I'm going to do everything in my power to help you and figure out what's going on and recommend things that are going to work. But, like, even just that, I think people kind of take a metaphorical sigh of relief and they go, oh, thank God.
Right.
Like, I didn't want that on my shoulders to begin with.
Right, exactly. Like, your role is to be honest, transparent, communicate well what's going on with the provider, and the provider's role is really to help dig to the root cause and things like that. So I think that that's a good practice from a provider standpoint to even acknowledge, like, I'm taking on this role. This is your role to implement change, not to try to determine what you need to change.
Yeah.
So, yeah, I think that's great.
Yeah. And look, we somehow segued way off of the prescription conversation, but I think it was a worthwhile conversation to have. And yeah, I think a lot of it still boils down to, like, having a team that you trust, whether it's one provider or multiple.
Yep.
But, like, having some degree of trust between you and the provider who's recommending the prescription is important, and knowing that you have somebody that you can talk to about, you know, the risk benefit analysis and what makes sense. I'll throw this out there as a side note too. I have found for myself that as a woman, at least, I go to a birth center for my primary care and I love it. It's fabulous. Like, so if you are female, you might want to look into that. Usually, a lot of times, birth centers work more with women. But what I found with our birth center here is that they will obviously work with you if you're pregnant and going to give birth, and then they'll work with you postpartum. But then after I gave birth to my daughter, we basically just transitioned into primary care. And, like, my birth center has a couple of nurse practitioners on staff. And because they work at a birth center surrounded by midwives, you know, there's like 12 midwives and like 2 or 3 nurse practitioners. And, you know, it's like, in that environment, I find that the providers who are hired to work at a birth center are automatically going to be much more open-minded to natural stuff. And, like, I've seen that they're very open-minded. Like, I can tell the nurse practitioner at the birth center that I'm taking fish oil and ashwagandha, and they'll be like, okay, cool. They'll write it down. If you tell a normal primary care that you take fish oil and ashwagandha, they're going to be like, what?
Right.
Why? Or, you know, they're just not going to care.
Right.
And I found them to be very open-minded with, like, helping order tests or getting me a referral when I need a referral, or, like, actually just talking to me about, you know, risk. Like, I remember once I had thyroglobulin antibodies that were just a hair out of the range. The range goes from 0 to 0.9, and mine was 1.1. And it showed up on some blood work, and I remember I had an appointment with my nurse practitioner, and I asked her, I was like, is this like the beginning of Hashimoto's? Should I be worried? Like, it's really on the cusp, and I don't know if I should care about this or not. And she encouraged me. She said, you know, we could rerun it in a couple of months, but it's probably nothing. It's probably just like a little blip on the radar, and it's probably going to be negative next time. Like, I wouldn't worry about it. And then sure enough, in subsequent blood draws now for the last few years, it's been totally normal and low. It was just a blip. But, you know, even stuff like that, like, she took the time to talk to me about what that test result meant when I was kind of on the fence for whether or not I should care about it. So for what it's worth, birth centers, not always, but oftentimes, will have the ability to do primary care for women. So that has been a good experience. And I have some other women who I've recommended that to, and then they've switched primary cares to a birth center, and they've been very happy with that transition as well.
Yeah. Well, and I think too, if you have a provider that's more natural, like a naturopath or a functional medicine provider of some sort, a lot of them don't really want to be your PCP. Or again, I remember my functional provider, I almost treated her like the PCP, and she was like, no, I'm not your PCP.
No,
I'm like, okay. So
I've had people ask me that, and I'm like, no.
Right. Well, and I think, again, some people sort of treat their functional provider as the PCP, but I think it's really wise to try to find a PCP or something that will serve as a PCP if you're acutely sick, or again, if you want annual or biannual blood work, it's really helpful. I think that you can ask your provider that's more holistic and natural who they prefer or who they like. That can be really helpful. That's how I found my current PCP, was through my old functional provider, and he's great. So it's I think that, there are good PCPs out there. It just might take a little bit more nuance in searching and asking around as to which ones are better for your particular issue or situation.
And that's a good point too. I think I have a Word document on my computer that I jokingly named Legit and Not Legit Doctors.
Oh gosh.
And it's literally that's what it's titled. And literally I organize it by location, and then I organize it based on specialty, but I have a list of primary care doctors, rheumatologists, GI doctors, all these different specialties for people who I've referred to before, or I've had a patient who goes to that office and really, really like them. But that way I have a database of referrals for people. So if they say, I need an endocrinologist, I can be like, boom, there you go.
Yeah. Right.
Or I need a GI doctor, boom, there you go. So I do personally, I collect that data.
Right.
And I whenever people tell me in their appointments that, they interacted with their primary care, I'll ask them, tell me about your primary care. Do you like them? Right. Are they open-minded? Do they take time to talk to you? And whenever people say, yeah, they're really great, they take time to talk to me, they run labs for me, yada, 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 I'm like, can I have their name? And I write it down in that Word doc, not paper. I guess instead of this, I should have gone like this.
Right.
But yeah, I do keep a bit of a database for that because I want to know who's good, because there are a fair number of flops out there.
Right.
And it's not anything against them. I think that just a lot of doctors are very, very overwhelmed and burnt out and hate medicine. And
they have to see a bazillion clients in a day.
Yeah. Yeah, so it's not that they're rotten evil people, it's just that they're really burnt out and they might not have the capacity to be as nurturing as you need them to be. So you can seek out the people who are really good.
Right. For sure.
Yeah.
Yeah. Well, and I'm getting close to my exit time. So might need to
such an odd way of saying that we needed to
I
wrap
have
up
to
the
run.
episode.
Yes.
Your exit time.
My exit time is coming up.
Okay, well, I don't want to go over your exit time, you weirdo, so we can wrap it up here. But guys, you know the drill, but I'm going to tell you anyway. Thank you for listening to the IBS Freedom Podcast. If you're on YouTube, go ahead and click the like button, the subscribe button, I don't know, whatever buttons there are on YouTube nowadays, and leave a comment for us. I do actually check on the comments a little bit. I don't always get a chance to respond to them, but I do take a gander at what you're commenting on the YouTube channel. So say hi, drop us a line. We are out there somewhere reading your comments eventually. And if you're on an audio-based podcasting app like Apple, if you could rate us 5 stars, that would be amazing and wonderful, and we would be so deeply appreciative of that. And as always, tell your friends, tell your family that the IBS Freedom Podcast is the podcast to listen to. And we will see you next time for another episode about gut health. Gut health. I don't know.
About a topic yet to be decided.
Yeah, we'll keep you on the edge of your seat. We're not going to tell you. You have to tune in to find out what the next episode is going to be like. But until further ado, guys, thank you so much for tuning in, and we will see you very, very soon.